So I remember it well. The first time my doctor mentioned OCREVUS and that it was an infusion, I didn't want any part of it. But my doctor had a lot of patience and he understood my reservations. He sent me with materials to read through, and I was supposed to call his office with my decision. It took several weeks and another visit to see him before I was comfortable saying yes to an infusion.
I would say it is completely normal to feel worried about starting something new to you. To be honest, I was worried as well, but I had an open mind, I did all of my research, and didn't get discouraged. And now, I honestly feel really confident about my treatment.
The discussions with my doctor and nurse and the infusion center nurses are what helped me most to be prepared for my first infusion. They described exactly what would happen and when. In this video, a lot of that same information I was given before my first infusion will be presented. And I think it can be helpful for you too, as you talk about your first infusion with your healthcare provider.
As a healthcare professional, I think a lot of my patients, like Heather, can be quite apprehensive about starting infusion therapy, and that's understandable. But the more you know about infusions, the more you'll be able to make an informed decision about this type of treatment. Do not receive OCREVUS if you have an active hepatitis B virus infection, or if you have had a life-threatening allergic reaction to OCREVUS. And remember, tell your healthcare provider if you have ever had an allergic reaction to OCREVUS or any of its ingredients. Also important to know, infusion reactions are a common side effect of OCREVUS, which can be serious and in certain instances may require hospitalization. Most infusion reactions are mild to moderate and treatable with infusion adjustments and medicines.
Before my first infusion, I asked a lot of questions. My healthcare team also gave me some suggestions. I was worried, thinking about having an infusion and how I would feel and react. I took many suggestions, like drinking water, bringing a book to read, and even a blanket to help relax. The nurses were really great and had conversations with me to help keep me calm. It's always a joy to be around folks who truly care.
Now, you and your doctor may decide that for your multiple sclerosis, OCREVUS is the treatment that's right for you. OCREVUS is a 2 times a year prescription infusion for adults with relapsing or primary progressive forms of multiple sclerosis. Your first dose will be split between 2 treatments for a total of 3 treatments your first year. After the first dose, all future doses will be given as a single full infusion every 6 months.
From the time I arrived at the infusion facility, everyone was friendly and welcoming. When it was time for me to go to the infusion room, the nurses brought me pillows and blankets. Once the infusion began, I was checked on consistently to ensure all was well. I have to say, I felt totally supported and attended to the entire time.
OCREVUS infusions can be given at an infusion center, your doctor's office, or at home, depending on what you and your doctor decide is right for you.
My doctor and I made the decision to have my infusion done at home. I was walked through the process from start to finish. Once my nurse arrived, she prepared everything that she needed and got straight to work. She had a very calming voice and spoke with confidence. She answered any and all of my questions, from how the process would work to what the medication would do. This made me feel at ease because I was nervous about having an infusion at home and wanted to assure myself that it would be as safe and professional as going to an infusion center.
No matter where you have your infusion, your doctor or nurse will walk you through the process and answer any questions you may have. Your first dose is 2 separate infusions, 2 weeks apart, with the infusion itself lasting about 2.5 hours. All following doses are 1 single infusion every 6 months. The infusion time itself for these following doses is about 2 to 4 hours, but may take longer if there are infusion reactions. If you haven't had any serious infusion reactions with previous OCREVUS infusions, a shorter infusion option is available. Your doctor can determine if this option may be right for you. So, what does the infusion process involve? Well, it all starts with the people who will take care of you during your infusion.
When I had my first infusion, the nurse was fantastic. The best thing she could have done was joke with me, and she did. We used laughter to get through the first infusion. She was calm, which made me calm. She was extremely knowledgeable, and I felt so taken care of.
Here's what your infusion experience may look like. Before your infusion begins, your healthcare team will check your vital signs, evaluate for active infections, and ask questions about your overall health. Then, 30 to 60 minutes before your infusion, you will be given medications such as corticosteroids, an antihistamine, and anti-fever medication to reduce possible infusion reactions. During the infusion, comfort is key. You'll be seated in a supportive chair along with all of your belongings. Be sure to have some entertainment and snacks on hand to pass the time. Once you're settled, an IV infusion needle will be placed in your arm and connected to an infusion pump. Your infusion will last between 2 to 4 hours. Your doctor can determine if the shorter 2-hour option may be right for you. If an infusion reaction occurs, your healthcare team may stop or slow the rate of your infusion. Your healthcare team will monitor you closely from start to finish. And you can relax knowing that your healthcare team is there to help the process go smoothly. Some people even take a nap, and that's perfectly fine. You should know that OCREVUS can cause infusion reactions that can be serious and require you to be hospitalized. Most infusion reactions are mild to moderate and treatable with infusion adjustments and medicines. Post-infusion, you will be monitored for at least 1 hour for signs and symptoms of an infusion reaction. Contact your healthcare provider or nurse if you experience any reactions after your infusion or have any questions about the experience.
So about 30 minutes into my infusion, I had noticed a little itching in my throat and ear, and I immediately let the nurse know, as she had asked me to report any symptoms related to a possible infusion reaction or anything else that I felt wasn't quite right. She immediately came and began her assessment and quickly called my doctor, who advised her to interrupt the infusion so she could administer an additional dose of the anti-allergy medication. The reaction was stopped. After the infusion was finished, I was monitored for another hour and everything was good from there.
What are the signs of an infusion reaction? Here's what to look out for: itchy skin, a rash and hives, tiredness and fatigue, trouble breathing, dizziness, and the other signs you see listed here. Please see the end of this video for additional important safety information. You can also visit OCREVUS.com for even more information. And please remember, if you're experiencing any of these, say something right away. There are ways your healthcare team can help you. Here are some tips on preparing for your OCREVUS Infusion Day from people who've been there.
If you and your doctor have decided that OCREVUS infusions are right for you, keep in mind the better prepared you are for your infusion, the better your experience can be. So keep a handy list of the medications you're taking so you can share with your healthcare team and have a list of all the healthcare providers who help manage your care. So once you're ready for your infusion day, you need to be comfortable. And here's a few tips about that from Pastel.
The more comfortable you are, the better. Wear loose-fitting clothes and consider dressing in layers so you can be as cool, as warm as you want. Definitely stay hydrated. Have a bottle of water by your side, have items that you enjoy nearby to help keep you occupied. Things like a laptop, something to read, or a puzzle book. I suggest bringing some pictures of the people you love with you. I always bring pictures of my parents, and that makes me feel like they're there with me. Thinking of my childhood memories with them helps me smile and relax. It's very comforting.
Also, have food or snacks with you, but check with your infusion provider first to see what their policy is. And a pillow and blanket are good to have in case you get sleepy. Remember to have your chargers with you for any devices you want to use. And ask your infusion facility or the provider who will do your home infusion if you can have a friend or loved one there to keep you company.
My best friend picked me up to take me to my first infusion, and I needed to be strong and to laugh a lot. And that's exactly why I brought her. She knows me well enough to pull me out of my own head and distract me. We ended up being entertainment for the medical staff for the rest of my infusion.
You can also call OCREVUS Connects before your infusion at 844-OCREVUS and speak with a patient navigator about any questions you might still have concerning your infusion.
The OCREVUS patient navigators from OCREVUS Connects were great. They called to let me know the process with the infusion, and I can tell they genuinely cared. And they made sure I had all of my questions answered.
I hope this video was helpful, and please have a conversation, or many conversations, with your doctor about OCREVUS and the infusion process. That's the best advice I can give.
What is OCREVUS? OCREVUS is a prescription medicine used to treat relapsing form of multiple sclerosis, MS, to include clinically isolated syndrome, relapsing-remitting disease, and active secondary progressive disease in adults. Primary progressive MS in adults. It is not known if OCREVUS is safe and effective in children. Who should not receive OCREVUS? Do not receive OCREVUS if you have an active hepatitis B virus, HBV, infection. Do not receive OCREVUS if you have had a life-threatening allergic reaction to OCREVUS. Tell your healthcare provider if you have had an allergic reaction to OCREVUS or any of its ingredients in the past. What is the most important information I should know about OCREVUS? OCREVUS can cause serious side effects including infusion reactions. Infusion reactions are a common side effect of OCREVUS, which can be serious and may require you to be hospitalized. You will be monitored during your infusion and for at least 1 hour after each infusion of OCREVUS for signs and symptoms of an infusion reaction. Tell your healthcare provider or nurse if you get any of these symptoms: itchy skin, rash, hives, tiredness, coughing or wheezing, trouble breathing, throat irritation or pain, feeling faint, fever, redness on your face, flushing, nausea, headache, swelling of the throat, dizziness, shortness of breath, fatigue, fast heartbeat. These infusion reactions can happen for up to 24 hours after your infusion. It is important that you call your healthcare provider right away if you get any of the signs or symptoms listed above after each infusion. If you get infusion reactions, your healthcare provider may need to stop or slow down the rate of your infusion. Infection. Infections are a common side effect. OCREVUS increases your risk of getting upper respiratory tract infections, lower respiratory tract infections, skin infections, and herpes infections. Serious infections can happen with OCREVUS, which can be life-threatening or cause death. Tell your healthcare provider if you have an infection or have any of the following signs of infection, including fever, chills, a cough that does not go away, or painful urination. Signs of herpes infection include cold sores, shingles, genital sores, skin rash, pain, and itching. Signs of more serious herpes infection include changes in vision, eye redness or eye pain, severe or persistent headache, stiff neck, and confusion. Signs of infection can happen during treatment or after you have received your last dose of OCREVUS. Tell your healthcare provider right away if you have an infection. Your healthcare provider should delay your treatment with OCREVUS until your infection is gone. Hepatitis B virus, HBV, reactivation. Before starting treatment with OCREVUS, your healthcare provider will do blood tests to check for hepatitis B viral infection. If you have ever had hepatitis B virus infection, the hepatitis B virus may become active again during or after treatment with OCREVUS. Hepatitis B virus becoming active again, called reactivation, may cause serious liver problems, including liver failure or death. Your healthcare provider will monitor you if you are at risk for hepatitis B virus reactivation during treatment and after you stop receiving OCREVUS. Weakened immune system. OCREVUS taken before or after other medicines that weaken the immune system could increase your risk of getting infections. Progressive multifocal leukoencephalopathy, PML. PML is a rare brain infection that usually leads to death or severe disability and has been reported with OCREVUS. Symptoms of PML get worse over days to weeks. It is important that you call your healthcare provider right away if you have any new or worsening neurologic signs or symptoms that have lasted several days, including problems with thinking, eyesight, strength, balance, weakness on one side of your body, using your arms or legs. Decreased immunoglobulins. OCREVUS may cause a decrease in some types of antibodies. Your healthcare provider will do blood tests to check your blood immunoglobulin levels. Before receiving OCREVUS, tell your healthcare provider about all of your medical conditions, including if you have ever taken, take, or plan to take medicines that affect your immune system, or other treatments for MS. Have ever had hepatitis B or are a carrier of the hepatitis B virus? Have a history of inflammatory bowel disease or colitis? Have a history of liver problems? Have had a recent vaccination or are scheduled to receive any vaccinations? You should receive any required live or live attenuated vaccines at least 4 weeks before you start treatment with OCREVUS. You should not receive live or live attenuated vaccines while you are being treated with OCREVUS and until your healthcare provider tells you that your immune system is no longer weakened. When possible, you should receive any non-live vaccines at least 2 weeks before you start treatment with OCREVUS. If you would like to receive any non-live, inactivated vaccines, including the seasonal flu vaccine, while you are being treated with OCREVUS, talk to your healthcare provider. If you have a baby and you received OCREVUS during your pregnancy, it is important to tell your baby's healthcare provider about receiving OCREVUS so they can decide when your baby should be vaccinated. Are pregnant, think that you might be pregnant, or plan to become pregnant. It is not known if OCREVUS will harm your unborn baby. You should use birth control, contraception during treatment with OCREVUS and for 6 months after your last infusion of OCREVUS. Talk with your healthcare provider about what birth control method is right for you during this time. Tell your healthcare provider if you become pregnant while receiving OCREVUS, are breastfeeding, or plan to breastfeed. It is not known if OCREVUS passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby if you take OCREVUS. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. What are the possible side effects of OCREVUS? OCREVUS may cause serious side effects, including risk of cancers, malignancies, including breast cancer. Follow your healthcare provider's instructions about standard screening guidelines for breast cancer. Inflammation of the colon or colitis. Tell your healthcare provider if you have any symptoms of colitis, such as diarrhea, loose stools, or more frequent bowel movements than usual. Stools that are black, tarry, sticky, or have blood or mucus. Severe stomach area, abdomen, pain, or tenderness. Liver damage. OCREVUS may cause liver damage. Your healthcare provider will do blood tests to check your liver before you start OCREVUS and while you take OCREVUS if needed. Tell your healthcare provider right away if you have any symptoms of liver damage, such as yellowing of the skin and eyes, jaundice, nausea, vomiting, unusual darkening of the urine, feeling tired or weak. These are not all the possible side effects of OCREVUS. Call your doctor for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Genentech at 888-835-2555. For more information, go to www.ocrevus.com or call 1-844-627-3887. For additional safety information, please see the full prescribing information and medication guide.